There's so many problems with taking oral medications at the end of life. If the Macy catheter was in place and they had the medications they needed and could administer them, then we would avoid a GIP admission, which is hundreds and hundreds of dollars a day. So it's so much easier. I think it can give more ease to the patient and to the family. So I was on call. I got called by the nurse for a patient who was having severe pain and anxiety and nausea and was not able to tolerate anything by mouth. And they couldn't get enough medication in, even with liquid, even with sublingual. The volume was too much for this patient and they couldn't get the meds that they needed. And we were talking about GIP because the patient was really in extreme discomfort. And we had just had this in-service on the Macy catheter. And I said, "Oh, why don't we try the Macy catheter?" And they were willing to try, and it worked perfectly. And the patient got comfortable, I think within I don't even know what, it was a half an hour or something. And if that had not worked, it would have taken hours probably to find the right place for that patient to go GIP in the middle of the night in rural Vermont. And instead, the patient got to stay home and was totally comfortable for the rest of their life. I think the misconception is that it's going to be uncomfortable, that it's going to interfere with the patient's dignity. And in reality, it's a minute, and then after that, you can be clothed and there's no discomfort, and there's no problem with maintaining dignity, and patients don't even notice that it's there. It actually, I think, there's so many problems with taking oral medications at the end of life. So it's so much easier. I think it can give more ease to the patient and to the family. It's always better to introduce something when you're not in the middle of a crisis, right? We have this option. It's really comfortable. It removes this whole other set of problems that people have: trouble swallowing, nausea, trouble absorbing. If the Macy catheter was in place and they had the medications they needed and could administer them, then we would avoid a GIP admission, which is hundreds and hundreds of dollars a day, and multiple nurse visits where the nurse has to drive sometimes hours to get to a distant rural place that may have terrible roads because of where we live. I think, the families are going to be more relaxed and say, okay, here we have this way of treating this patient's symptoms and we can give as much as we need. And it's not going to be a problem. We don't have to worry about them throwing up. And if there's an issue or question, they just need to call